Good morning and welcome to the panel on health as part of the Future of South L.A. conference. We appreciate our attendees here today. We have assembled, I think, a very dynamic panel that reflects the breadth of the issue of health. Health is more than access to medical care. It is very much about the community and environment in which you live, grow, and enjoy life. South LA is not without its challenges, and so the fact that this is a part of this discussion is significant. I'm Lark Galloway Gilliam. I am the Executive Director of Community Health Council. We're a nonprofit organization here in South Los Angeles. We had prepared a report in 2008 on the health equity of South Los Angeles, demonstrating that we are indeed faced with a great many challenges. And so here today to lift up some of those issues and provide you with insight will be Dr. Rick Baker with Charles Drew University School of Medicine. He is the Associate Professor in the Department of Ophthalmology and is also with the Jules Stein Institute at UCLA. Following Dr. Baker will be Yolanda Vera. She is the Health Deputy for LA County Supervisor Mark Riley Thomas. Yolanda serves as the Senior Deputy and oversees a great deal of the issues related to the county's capacity, resources, and strategies around health. She has extensive background in civil rights with a dedicated focus on health-related matters. Following Yolanda, we will have Paul Hernandez. He is the Vice President for Fenton. Paul has more than 14 years of public policy, government relation, and strategic communications experience on issues ranging from healthcare and education to public safety and violence prevention, all which we consider within the domain of health. After Paul, we will hear from Faisal Roble. Faisal is the Senior Planning Director for the City of Los Angeles Planning Department. Faisal has worked as a city planner for more than 18 years and is currently the Senior City Planner for South Los Angeles, East Los Angeles Planning Region. He is responsible for overseeing the implementation of planning functions in South Los Angeles, Southeast, and the West Adams planning area. And finally, we will be hearing from Malcolm Carson, who is with Los Angeles Legal Aid Foundation and is also a commissioner for the Department of Transportation here in the city of Los Angeles. Malcolm has extensive experience in city planning issues and the interface and engagement of community residents. And with that, I believe we will start with Ms. Vera, who will talk to us a little bit about what the County of Los Angeles is doing to address the healthcare needs in South Los Angeles. Yolanda?
Great, and I think we have a PowerPoint. The good news is that there's so many things that are happening in South Los Angeles around healthcare delivery, and because of time, we can't cover everything. So I'm going to focus on three issues. One is infrastructure as it relates to healthcare. Second, we're going to talk about jobs. And then third, I wanted to talk a little bit about services and some of the things that we're doing around equity and services. So if you can please raise the first slide. This is very hard to read if you're on this side, but this slide gives an overview of the various health-related capital projects that we're undertaking in South Los Angeles, most of them around the new Martin Luther King Hospital, but not exclusively around the new Martin Luther King Hospital, some in the surrounding area. The county is investing a lot of effort and money to really think about how we can better use our county-owned property to improve the health of the community, and health in the broadest interpretation. So if I run down these slides, it gives you a sense of some of the things that we're working on. Go back to that same slide. One is on the metro station. Right just north of the Martin Luther King campus is the Rosa Parks station, which is the only place where the green and the blue lines intersect. So there's been some efforts to improve that, to bring folks more easily into the community, to not only use the health facilities, but also to use some of the retail facilities, to try to create more vibrancy in that area. Next is we're undertaking a master planning process on the MLK campus. I've got some flyers for folks who might be interested. We've got 38 acres of space that we're using right now where the Martin Luther King Hospital sits. We need to think more creatively, how can we better use that space? Can we put in community gardens? What can we do about walking areas? What can we do about bringing in fitness parks? And really want your input. Our next meeting on this is July 7th, and hope that you'll come. The next is, stay on that same slide, is a few new buildings that we're working on. Great news that come August, we expect to have the grand opening of a new public health center that's right there on the corner near 120th and Wilmington. And it's a state-of-the-art facility. We'll have a large meeting room with a community kitchen where we can teach residents how to cook healthier foods. It's going to provide the full range of public health services, from screenings for sexually transmitted diseases, immunizations, TB, et cetera, really focusing on nutrition and wellness. And that's going to be opening in August. We're underway on efforts to try to create a new allied health career academy. One of the missing components in the MLK campus area has been the community colleges. And is there a way, given the demand in the community for more jobs, that we can train people in the community to go into allied health professions and then hire them to work within the safety net? So we're really, really hoping that we can accomplish that and put that next to the MLK campus. We're started to break ground on the new inpatient tower for the hospital, and then come August, September, we expect to break ground on a new improved ambulatory care center that's going to provide more primary care, urgent care, specialty care visits in the community. Expect that to come to the board for approval in September. Let's see, we've made some modest improvements on our mental health facility, the Augustus Hawkins Center. We've got a new library and some library improvements that are underway. And we have a walking park that's going to be next to the South Health Center. And then we're doing some other things in the surrounding area around Humphrey. One is, Humphrey is a large specialty care clinic that we've made some improvements to improve access to patient care. And then we also have a large amount of work that we're doing at our big sister hospital down towards Carson, which serves a number of people from South L.A. About half of the patients are from South L.A., and that's Harbor UCLA Medical Center. We're expanding and improving the emergency room and trying to figure out how we can expand the number of beds as well, too. Now, next slide. One of the things that's been a priority for the supervisor with all this new investment in capital infrastructure, and especially looking at healthcare, that health is just more than going to see your doctor. It's also stress. And a main contributing issue on stress in that community has been the need to get jobs. So he has pushed through a local worker hire policy that applies to the MLK inpatient tower projects as well as the MAC projects. We're really trying to emphasize this for all the county's investments so that those jobs go to persons living within the 5-mile radius. Let's see here. And I think all told, and this is just health-related capital projects, they'll create about 8,300 new jobs, just the health-related capital projects in the 2nd District alone. Next slide. Now I want to talk a little bit about services and equity. Lark mentioned it a little bit and has really been a leading voice on how we can do a more conscious, better job at ensuring South LA gets its fair share. And that when the County of Los Angeles makes decisions on what services to put where, we do it on a needs-based approach. We need to improve. We have a long ways to go. And this particular slide is a slide to illustrate how the county spends its dollars for private low-income, low-cost clinics that treat patients who are low income in the county. The county spends about $55 million a year. 5 minutes? Okay. The folks in the room here, there's this concept called service planning areas. Have you ever heard of that? Some of you are nodding your heads. Let me back up. The county of Los Angeles is huge. I mean, we are so huge. We're bigger than most, countries. And for health planning purposes, because it's too big to plan for all at once, the county splits it up into what are called service planning areas or SPAs. South Los Angeles makes up SPA 6. So what we did is we took a critical look at how is the county spending and paying for clinic services? And are they doing it based on need? And is South LA getting its fair share? So if you look on this chart, the third from the right is SPA 6, South LA. Okay, you'll see two columns, a light blue column and a dark blue column. The county has this mathematical, scientific formula to determine need. And because they know they have so much resources, only $55 million a year they can spend, how can we divide this pie so that proportionately it goes to the areas most in need? What the light blue column shows is that South LA was getting half of what it should have been getting under this formula. I'll say that again. South LA was getting half of what it should have been getting in county dollars according to this needs-based formula. So the county in 2009 came up with a new batch of dollars, which is really unusual. They came up with $45 million more dollars to try to apply to even this out a little bit. And the South LA clinics did really well, but look, we're still at 75% of our proportionate need. So we have a long ways to go on this, and this is hugely important for the community because we are at this historic juncture where in 2014, we're going to start rolling out health reform. And our clinics have got to be ready because a lot of uninsured individuals they'll have insurance, they'll suddenly have a card where they're covered, and they're going to need a medical home and a place to go. So the county and the supervisor did a motion to get the county to start looking at this. We have to keep our eye on the prize and get our fair share of the funds, whether it's clinic funds, whether it's mental health funds, whether it's alcohol and drug funds. I had so many other slides I could show you. I could show you how South LA was at the bottom of the priority list in terms of getting its county-owned facilities fixed. That all the requests to fix the facilities in South LA, they were like at the bottom of the list in terms of priority. So we're trying to do a comprehensive, really critical look and asking hard questions and collecting data so we can do a better job of this and start to make movement. Next slide. And some of the things that we're doing is the supervisor is really launching this effort to try to expand the number of school-based health centers, to go back to when the kids are young and to really partner with the LA Unified School District, Compton School District, Culver City, and how can we bring some of the county services that we're paying for anyway and make them available to school-age kids. And the way we do that is partnering with these private, federally qualified clinics to make this happen. So we've got 18 that are school-based health centers that are on either already going or about to get going in the district. A number of them are located in South Los Angeles. We've had a terrific partnership with the city on doing this in tandem, both with the infrastructure, capital, and land that the city has, and the county to bring the resources and the services to these schools. Next slide. So my last slide is there's lots of ways for you all to engage, and we'd love to have your engagement. We have a number of events coming up this weekend. We have a Relay for Life, and we'd welcome you to come and join us. A supervisor's going to be there with his jogging outfit on, so come just for that. We've got the next master planning meeting that I mentioned. We really would love your input and thoughts on what we need to do with the MLK campus and the surrounding area. And then we have the Empowerment Congress, which is an entity of residents in the 2nd District that informs our office on priorities and activities we should be taking around health and other issues. So thank you.
Thank you, Yolanda. As Yolanda talked about the fact that there is a SPA in which we see not only health disparities, but a disparity in terms of resources. Taking it to the city level, I want you to understand that when you look at life expectancy in the city of Los Angeles, it's CD8 and CD9. The difference in life expectancy is on average 8 years. That means we are living 8 years less, fewer years than that percentage within the overall city. And to get an understanding of that, we have now Dr. Rick Baker, who's going to talk to us a little bit about the health status of South LA. Dr. Baker?
Thank you very much. Thank you very much, Lark, for inviting me. And I'd like to say, Yolanda, your presentation was great. I'm very excited about the investments being made in South Los Angeles today. And what I'd like to do is put those investments in context. I'm going to talk big picture, 10,000 feet. Luckily, all the data, all the information will be a little bit superficial, but all the information is on the DHS public health website in greater detail, and any maps that you see that I show you can be obtained from the GIS lab at Charleston University. So having said that, let me move rather quickly. Little challenge here to see the slides, but that's fine. So my overview, go back please, back. Okay, so overview. What I'd like to do is define the characteristics of the SPA 6 South SPA, which is a convenient proxy entity for South LA. I believe South LA extends beyond that SPA, but it's a convenient way to gather statistics and understand what's going on. So I'd like to talk about the sociodemographic characteristics of that SPA and also health status and health outcomes of that particular area. Then I'd like to move to some of the contributing factors to why you hear and you see these particular health outcomes. We'll talk about health behaviors, we'll talk about access to care and preventive services, and again, I'll try to move through this very quickly. Next slide, please. So we heard about the SPA. So now on this map, you see the 8 service planning areas in LA County. What we all must recognize and understand is the enormity of LA County. We have to put that in context. South LA is the largest urban underserved community in the United States. I'll say that again. South LA is the largest urban underserved community in the United States. It's 4 times by population, it's 4 times larger than Harlem, New York. If SPA 6 was a community on its own, incorporated, it would be the 10th largest city in the United States by the 2010 census. That means larger than San Francisco, larger than Boston, larger than Detroit. So again, when we talk about that particular area, we're talking about an enormous area. We're talking about whatever model works for South Los Angeles is the model for the nation. This is a very, very large area, very, very important area, and you see it. It looks modest within Los Angeles County and South, right in the middle. Usually it was South Central, and you can see why it was called that then. So we can move forward, please. Next slide, please. Okay, so let's talk about the characteristics of this area, South Los Angeles. First of all, age. This is the youngest service planning area by far. The distribution, 0 to 16, the highest prevalence of those. but it's also a very, very low prevalence percentage of people who are greater than 65. It's about, I think, about half the percentage of people for Los Angeles County are 65. So this is a very, very young population. Now, this has significance going forward. Because it's very young, what we see today will be predictive of whatever health status challenges much greater in the next 10 to 20 years. Because we're looking at the health status for a relatively young population that should be relatively healthy. Race is significant also, because it's the highest percentage prevalence of non-white individuals in Los Angeles County, one of the most diverse counties in the United States. South Los Angeles, 98% non-white. The next most predominant county is SPA is East, which has 18% white. So it's a large difference. Predominantly Latino and African American. It's a SPA with the largest percentage of African Americans. Foreign-born. It's a SPA with the second highest percentage of foreign-born individuals, and it's the SPA with the most individuals who mostly speak Spanish at home. Over 43% of individuals mostly speak Spanish at home, so a lot of linguistic isolation. Number one, with respect to poverty, people below 100% FPL. As you see, relative to the county, about 28% poverty versus 16% for the county and 12% for the country. So there are more than twice as many people with the status of extreme poverty in South Los Angeles than in the United States. Next slide, please. Households, go back. Households with children, a young demographic, and again, this is the only area where the majority of households within this area have children in them. So again, this is important. Education, you see the number 8. It's the worst SPA in terms of education, in terms of educational accomplishment. It has the most individuals who have less than a high school education, and you see there 39% versus 22% in the county. And even more damning, it has the fewest individuals with college degrees. And again, 9% versus 35% for this county. So I'll go back to that. We're talking economic development. This is very, very important, changing that educational demographic within that SPA. So some of the investments that we heard about actually is focused on doing that. Employment status, as expected, highest unemployment rate, lowest employment rate, which is not always the same, and the largest number of disabled individuals who are unable to work. Next slide, please. So let's talk about the health status with these demographics. Quality of care and health status. The highest percentage of individuals, again, who feel that they and their children have extremely poor health, and that's born to be true when you look at the statistics. Their perceptions are correct. Number one in the county in obesity, highest percentage of people who are obese, I believe both adults and children, highest percentage of diabetes, highest percentage of death by cardiovascular disease, I think second in stroke, highest percentage of people with hypertension, reproductive health, highest percentage of teen pregnancies, prevalence of teen pregnancy, highest percentage of low birth weight children, or in very low birth weight children, and go forward. And again, this context will be more important when you see the infrastructure available for these individuals. Now go forward, please. Mental health, as was said, highest percentage of people who say that they have mental distress, highest percentage, most number of days that people cannot work based upon mental distress. Injury, of course, homicide, very, very high in this area, but also motor vehicle injuries, number 2 for that. Cancer, number 1 in cancer in breast and colorectal, number 2 in lung and cervical. Communicable diseases, it's tremendous, particularly gonorrhea and chlamydia. Very, very, very high rates that hopefully will be addressed with a new public health clinic. And then finally, premature mortality. It's the highest rate of premature mortality. What does that mean? Those are individuals who die too young. whether you define it by dying before not reaching 75 or not reaching 70, whichever way you define it, more people die too young in Service Planning Area 6 in South LA than any place in LA County. So the picture, you can go forward. The picture is rather bleak, right? It's challenged, not bleak, but it's challenged. And so what we should go to, if we want to make a difference, we need to look at, well, what are some of the characteristics that might contribute to this health status overall? And again, so we look at health behaviors and physical environment. It's a number 2 spot with respect to percentage of people who engage in binge drinking. It's number 2 in terms of tobacco use. Now, tobacco use, again, California has very low tobacco use across the board compared to the rest of the country, but again, number 2. And number 2 being worse, number 1 being the worst. Unsafe neighborhoods, limiting activity. That's far and away South Los Angeles. The individuals, the members, residents of South Los Angeles feel that their neighborhood is too unsafe to engage in physical activity, or their children to engage in physical activity. Fruit and vegetable composition, last in the county. In terms of their perception of quality of food and vegetables available to them, last in the county. Children's consumption of fast food, second in the county. And finally, sweetened drinks and sodas, first in the county. These are not good habits, right, and they contribute. But let's go forward, please. Preventive services. Mothers receiving late or no prenatal care, again, women's health. Second worst in the county. Women receiving pap smears. Now that's good. That's one of the good things. It's the best in the county in terms of receiving pap smears. Adults, and this is a little worrisome, adults who are vaccinated for influenza and adults who are vaccinated for pneumonia, right? Last in the county, okay? And again, this is very, very dangerous as we go forward. Okay, so finally, access to care. Uninsurance, close to 40%, I believe, uninsurance. And the highest rates of uninsurance both for adults and for children, right? Implications, maybe with health reform it'll change some, but again, the characteristics that probably will not change enough. And again, availability of regular source of care, second worst in the county, again, in terms of availability. Difficulty accessing medical care, great difficulty, worst in the county. Difficulty accessing dental care, worst in the county. Difficulty obtaining needed prescriptions because you could not afford them, first in the county. So again, we have these challenges. And if we know the challenges and we look at, in part, what infrastructure is available to meet those challenges. Next slide, please. Here you see the red stars are hospitals. This is straight from Oxford yesterday. Straight, the ink's not even dry. But these are open hospitals in LA County, acute care hospitals. The yellow area is South LA. If I didn't know better, I would say South LA was allergic to hospitals. It's incredible. It's incredible. And what you don't see is many of the abutting hospitals, the closer hospitals, are actually rather small in size. And again, what's happening now, what the county is doing now is great. The investment it's making is absolutely needed with respect to the campus. But again, this is a 112-bed hospital for 1 million people. Now, if we went to Boston and Detroit or San Francisco and said, we have no hospitals in the city, and somebody said, well, let's construct a 112-bed hospital. It's not it. But we start somewhere, and the commitment is to have that care, and it will build from there, I'm sure, right? But I'm saying this is still a Band-Aid on what's really needed for that community. We go forward, and you see that community, so you say, well, maybe it's the number of people. What you see here, what's darkest, are the most dense parts of Los Angeles. And surprisingly, South LA is the most dense part of Los Angeles. It's even more dense than Metro. And so you see that. So it's not because, and again, it's the bottom, where you see the hospitals now is in Metro, but all of the underneath that real dense patch of people still has no hospital, has no health care. Go forward. And finally, this is a distribution of physicians. These are health profession shortage areas, those really light areas, the health profession shortage areas. And you see right contiguous with South L.A., if you can see with South L.A., you see going straight down the spine of South L.A., those are all of those areas, one right after the other, right after the other. So it's not like you can move from one service area to another. They're right next to each other. You also see that there is also areas in other parts of Los Angeles which are important, which will need care, which do need care. They do need hospitals. And specialists, this is for primary care, but specialists, the deficits are even deeper. In some of the other areas, again, one of the differences is the density of individuals. So an area can be affected by a low number of physicians, but if that area does not have a lot of people, the effect will not be as great. So again, when you go to South Los Angeles, just the sheer numbers of people affected by the fact that we have not much medical infrastructure available is very, very important. Now, what I showed you the hospitals and I showed you the doctors, but all of the other infrastructure that is related to that follows the hospitals and the doctors. So put in the diagnostic centers, put in the surgical centers, put in all of those centers, and it follows the same pattern. Yolanda, one of the things she said, which I thought was, which I do know, is really, really important. Healthcare has been shown time and time and time again to drive the local economy. Healthcare creates jobs. So solving the healthcare problem, the health status problem, I think will go a long way to solving some of the other issues related to economic development and economic sustainability. So I think I'm finished today within my thoughts. Thank you.
Thank you, Dr. Baker. I think that's very enlightening and puts in context the rest of the conversation that we're going to have. You've heard about what the public sector's response is. Want to now turn to Paul Hernandez, who will give us some insight in what foundations are doing. Because, of course, this is not new, and there's a great deal of attention, clearly data, to point out the needs, what is happening within the foundation world as respect to this, and then also talk a little bit about the implications of national health care reform and what that might mean for South L.A. Paul.
Thank you, Lark. So I think Dr. Baker lends an important context. So just to reiterate, what you have in South LA is kind of the worst of all worlds in some extent. You have the worst health outcomes in the county and some of the worst health outcomes in the nation in terms of how healthy the population is. The healthcare infrastructure is not set up and we have the least amount of hospitals throughout the county. We don't have enough doctors to serve this unhealthy population who's going through a tough time, coupled with an environment that resists and doesn't contribute to people maintaining good health. So the fact that we have, severe violence, poverty, unemployment, all these different factors that are obviously contributing to poor health. And so what we're seeing, though, fortunately, is a level of private investment and funding that's coming to South LA that recognizes the big challenge and the hill we're trying to climb. Yolanda mentioned what the public sector, what the county is doing to really try to address some of these issues. At the same time, there's a level of private sector investment, particularly from foundations, that is coming in to sort of address these things. And we're seeing it in a number of different ways. So probably the way to summarize sort of how the investment is being provided South LA on a few different levels. I think one is there's a real focus on really trying to improve the health of children and families. And as Dr. Baker mentioned, you have a very young population in South LA. So in that way, it makes sense for that to be a target for a lot of this funding coming in. The other piece is that you have a number of foundations who, while we don't have in South LA many hospitals or hardly any hospitals really, we do have a number of community clinics. So whether we have St. John's, whether we have UMA, THE, the county runs clinics down there, and that has sort of helped to, in essence, fill the hole that hospitals haven't, because of the lack of hospitals, many people turn to the clinics in order to get care. And many of the foundations have been providing a lot of funding, along with the county, to support clinics being able to provide primary care, to be able to provide specialty care, so that people can actually get and receive medical services. The other piece has been more of a public health focus. So I think as Dr. Baker and Yolanda have mentioned, there's a lot of issues that obviously affect someone's health. So whether it be the neighborhood they live in, whether it be the fact that they can't go to a grocery store to get fresh fruits and vegetables for their children and are forced to go to fast food because it's the only option available. There's sort of all these things that impact one's ability to maintain a good health. And so you're having a lot of funding coming in to improve and address some of those larger public health questions. So it's not just an issue of how do we have people have a hospital or a doctor or a nurse to go see, but how do we create a living environment that helps lead people to be more healthy? So you have funding coming in under that scenario too. With healthcare reform, the opportunity there is on a few different levels. I mean, in terms of the new healthcare law, I think one is, as Dr. Baker mentioned, you have a significant amount of people in South LA who don't have healthcare coverage and healthcare insurance. And what that means is that usually people end up putting off going to see a doctor or going to go into a place to receive care because they have no way of paying for it. And so when, it's like anything else, the longer you wait, the worse it gets. And so because you have such a high number of people who are uninsured, it makes the population that much more unhealthy. So under the new healthcare law, over the next several years, and it's actually starting with some federal funding that's coming into place under what's called the federal waiver. And it's really meant to provide and expand healthcare coverage to low-income populations. And so the idea is to try to get more people insured so that they actually have somewhere to go. So I think that's going to certainly be one opportunity over the course of time that happens with healthcare reform. Now, with South LA, and it's not just with South LA, but it's very significant, there is still going to be a number of people who will remain uninsured under the healthcare law. Individuals who are undocumented, individuals who are hard to reach, like the homeless. So it certainly helps to address some significant problems we have in our system, but it's certainly not a silver bullet. And so we're still going to continue to need to provide ways that people have a place to be able to get care, even if they don't have insurance. The other thing that the healthcare law is doing is it's trying to find ways to improve the way the system functions. So for many of the people out in the community, there's sort of no integration and coordination among the providers. So a lot of times you'll have a family member, they'll go to one clinic to get care, maybe they move somewhere, they go to a different clinic to get care, but those providers aren't talking. And sometimes there's duplication, there's waste of resources, you're not getting the kind of quality that family or that individual needs. And so one thing that the healthcare law is really pushing on is that there to be a lot more communication, partnership, integration between the providers. And one thing that's already starting in South LA is there's St. Francis Medical Center, coupled with many providers who provide care in South LA, are starting to come together to figure out how they can really start to band together to create a better way to deliver care. And that's something different funders are certainly looking at, but it's certainly something that under the healthcare law, it's really being able to push and encourage the way the system works. So even in other places that have a lot of hospitals, a lot of docs, a lot of clinics, they don't have that, the system isn't operating like this. It's sort of all over the place. They're very individual, they're very siloed. And so the opportunity we have is to really try to bring it together. And I know the county has been part of that. And the fact that we have MLK Hospital, which is going to be a really important linchpin to make the system work a lot better. And how MLK is going to work with the clinics and other providers is going to be really key. To give you also another sense to get a little bit more detail about some of the funding that's coming into South LA, you have a number of funders who have specifically chosen South LA to direct significant amounts of resources. So you have different funders who fund all over the state, all over LA County, all over the country. But what they've said is we're gonna select certain communities that really need help and that really need resources and really focus on them. So the California Endowment, which is the state's largest health foundation, is doing such an effort. So they've selected 14 communities across the state to really direct resources to really do more of a public health approach to trying to improve health outcomes. One of those communities is in South LA. And that work has already started. And some of the issues that they've been talking about has been greater access to fresh foods. How do we deal with better housing conditions? How do we deal with issues of crime and violence? Dealing with issues of incarceration, which we know is a really key issue that's going on in South Los Angeles. And so they've been really investing resources toward that particular initiative, which really could benefit South LA, and that's a 10-year initiative that they've committed to. So this is going to be a real key opportunity for South LA as far as being able to, and it's not the whole region. Let me be really clear. It's a particular area of South LA, but it could have a ripple effect, which I think is going to be important. First 5 LA is doing something similar, except they're focused on LA County, but they too have selected 14 communities around LA County to really focus some of their resources on. 4 of those 14 are in South LA. And so yeah, it's another opportunity where they're really focused on children 0 to 5. How do they grow up healthy? How are they born healthy? How do we make sure that they're ready to get into kindergarten and they're able to sort of do that? And so that initiative is just starting, and there have been a number of meetings out in the community to really start to figure out, and they're trying to bring community members together to talk about what is going to be the approach they ought to take to sort of deal with some of these issues that they're trying to address. You have California Community Foundation through its Sentinel Medical Fund that dedicates all its resources toward, improving healthcare in the Sentinel Valley, which is really, in large part South Los Angeles. And they themselves have been going through a very rigorous, and they've been funding in the community for years, but they're really trying right now to figure out how can they have better impact? How can they be able to really take some of the health outcomes that Dr. Baker mentioned and move us out of the #1 slot, which this is one of those ones we don't want to be #1 on for a change, and get us down the ladder. And so that's been something that they've been doing. Then you have a number of other foundations like Blue Shield Foundation, California Wellness Foundation, who are providing a lot of resources towards supporting the clinics, as I mentioned, improving their quality of care, improving their information technology, allowing them to have greater ability to be able to see more patients. So you're seeing a lot of resources coming in on that front. Kaiser, which actually, Kaiser is interesting because they don't only have their sort of, hospital and their health plan, but they do something called community benefit, which is really being able to put funding out in communities. And they have been really a supporter of organizations in South LA. They have been looking at some issues around, and Dr. Baker mentioned obesity and diabetes, as well as some of the other foundations I mentioned, to really figure out how we deal with that epidemic in South Los Angeles, and what is it that we're going to take to create safer places to exercise, to create, allow, and enable people to live better lives, and change the way that the behavior that they're engaged in, so they don't put themselves at greater risk for some of these diseases. Yolanda mentioned the school-based health centers, which a lot of funders are also supporting. So it provides another place where people can get care. And with the schools, it's usually because you have children who are becoming more at risk for type 2 diabetes, who are become more obese, who have issues like, who have mental health issues because of the violence that they see in their community. These become a really important place for them to receive care. And the idea is then how do we take that and then expand it potentially so that their parents and adults and others can sort of also receive care in that setting. So I mean, that's just sort of a broad framework. There's many of other funders who are certainly providing other resources, but that gives you, I think, a really clear idea of some of the things that are going on, I think, that are exciting. I think the key thing that's going to be important is how we're able to make sure all these things work together. So how does the private funding that's coming into South Los Angeles, leverage with what the county is doing and what the city wants to do and what Drew University wants to do, so that because the needs are so great, it requires us to be a lot smarter of how we use the resources. And I think as the commissioner mentioned, obviously the city of LA is struggling for funding, as is the county, as is the state that we know of. And so it becomes that much more important for how we use these resources in a really effective way, so that ultimately the community can benefit. And I think what we're seeing is it enough resources? No. Are we seeing an increase in the amount of resources coming into South LA? Yes. And so now it's how do we use them wisely? And so I think that's going to be a really important piece as we move forward coming out of this conference, is a lot of the people who are decision makers in this coming together to talk and figure out how we're going to make this work. Thank you.
Thank you, Paul. And now we want to sort of look at what is happening in the city of Los Angeles relative to policy. And one of the key areas is the city planning department. What many people don't recognize is that public health was really an integral part of planning in its early inception. That planning played the role of making sure that we had access to clean water and that there was separation of hazardous areas so that our communities were healthy. And I must say that the city of Los Angeles has worked and made some significant inroads into reestablishing its role and responsibility for the health of the community. And so now we have Faisal Roble, who will talk a little bit about what's happening in the planning department in response to the health crisis in South LA.
Thank you very much, Lark. As you guys see from my name and probably from my accent, you could guess now that I was born outside the United States. And when I listen to Dr. Baker's statistics, I feel like I had more access to health facilities growing up in an impoverished Ethiopian medium-sized town than some kid who is living and growing up in East Los Angeles. So that's a very damning judgment that the doctor passed on to. On my way to work this morning, I was listening to NPR, and Obama's czar for USAID, which dole is one of the largest monies to other nations, was interviewed on Afghanistan, and he used the same language that the US general is used in order to boost his argument as to what they are doing in Afghanistan. And he said something, and I was debating before whether to share this anecdotal with you or not, but after I heard the statistic this morning, I said, what the heck, I'm gonna say it. He used the word surge, and he said Afghanistan was challenging to the USAID as much as it was to the Army, but they had several surge levels of their service, and now they are impacting the issues in Afghanistan. And with this morning is the numbers about South LA and the statistics and the reality check, I'm just wondering whether the similar surge of public involvement and public sector investment in the greater South Los Angeles really is an issue to be looked at and to be lobbied for and to be campaigned for. Having said that, you're probably wondering what does a land use planner is doing at a panel that's very much dealing with health and the healthy issues. And I'll tell you a simple answer why I am participating at this panel. Because the entire land use law and entire land use planning and history is based on a similar situation that we are talking about today and this morning. It's called Euclid versus the city of Amber in the 1800s, where a small town sued a butcher house because the butcher house was next to a residential district. So under the code of the public health and welfare of the public's welfare issue, the issue was initiated, and that case went all the way to the Supreme Court, and it made the basis for land use planning and law. The point here is that public health and public health issues are a prime concern for planners, but you don't hear that. It's not addressed, it's not debated, it's not put into context. So if you see in the coming years people who are planners coming to panels that deal with public health, I think that's the thing in the future. We are doing a lot of things around the public health issue. I will share that with you. But let me just say, give you another anecdotal comparison between the public health issue and its relationship to land use planning and that of open space. The state of California mandates that every city should have what it calls an open space plan and an open space element. And in that plan, cities are required to show for every 1,000 residents in a given neighborhood, there has to be 10 acres of open space, whether they're in the form of parks or otherwise. How does the city get this open space? Two ways. Sometimes we plan for open space that's parks and regional parks and neighborhood pocket parks. And other times we collect QIMBY fee from private developers to make sure that the city has enough trust fund to create that. Maybe if there was a similar situation in the context of what we heard this morning, state law that mandates cities to create a mandatory access, public access to public health facilities, then land use could have played a more significant role in regulating the public access to health facilities. But we don't have that, so we're trying to do some other things, and I will share that with you. But let me just give you a little background of South Los Angeles, and I was very happy to hear Dr. Baker's statistics because it also matched some of our numbers. We estimate that the region that we call South Los Angeles, which is Southeast LA, South Los Angeles, what we used to call in the past South Central, and West Adams, Baldwin Hills, Leimert, has a total population of over 800,000 residents, 45 square miles. That's the size of the same city of Los Angeles, of San Francisco. Now, if you take the number of people who work on behalf of South LA, for example, in my planning department, you have 3 people plus me, because I have other responsibilities that I do. So my time probably would be half. So imagine the city of San Francisco having 4 or 5 planners and residents expecting some serious results. It would be a long time before those good results appear. I think there is some what we call disarticulation of resources versus the size of the region and the residents, whether it's in public health, in planning, or in other governmental sector. Unless you put the right resources into areas, unless you treat South Los Angeles like a city of a large size, because San Francisco by any standard is considered a large size city, then you won't have the results that you like, that you expect. But I have a bit, before I go to my positive information that I like to share with you, and I do understand the conference's title is The Future of South L.A., so I'll just quickly run what I see the future entailing for South L.A. But before I go that, let me just say that South L.A. has a very beautiful landscape of residential districts. You have homes that range from, say, $200,000 to $1 million when you go into the Baldwin Hills. So the diversity in terms of income is there. It has the highest income grossing African American population outside the Potomac belt. So it's a very affluent on the one hand, at the same time poor. But the only theme that unites the poor and the rich in South LA is that we have bad corridors that do not provide what we call amenities for urban residents. Corridors and your boulevards are dominated by auto dealership that are mostly used car sales, what South LA Community Coalition call it, cluster of nuisance uses on your nodes. In normal circumstances, the corridors and the nodes provide opportunities for residents. That's where your bakery is, that's where your retail stores are, that's where you walk with your child. But imagine a mother standing in front of a bus shelter waiting for the school bus to come, and on one side is a halfway home, on another side is a recycling, on another side is a motel, a cheap motel, and a liquor store. That is the built environment that we have in South LA, and we need to change that, and we are changing that. And this is the positive information that's probably changing. South LA has 23 of the 72 planned transit-oriented districts in the city of Los Angeles. That's almost 1/3 of those transit stations. And in any normal urban fabric, TODs or transit-oriented districts represent significant opportunities. That's where you place your retail, that's where you place your clinics, and in nowadays probably societies are moving from huge hospitals and going more and more as technology changes into small offices. If we take advantage of this transit-oriented corridors that we are planning, and from the planning department's point of view, we are giving incentives as much as possible so that the clinic moves, your doctor moves into those areas, your retail shops are located, then we can be successful. We are updating our new community plans for Southeast, South LA, and West Adams, and those will give us tools to address not only the retail shops and the other things that we talked about, but also to finally deal with the health issue. I've been showing the sign to move on very quickly, but let me just say that we are embarking on a new chapter that we never did in the past, which is to update our general plan and include a health element that will mandate the city to have policies to address health issues of South Los Angeles, and for that matter for the city, and also come up with implementation mechanisms so that those policies are put into practice. What do I foresee? I foresee a policy that the city has. Number two, I do foresee implementation programs that curtail the proliferation of liquor stores, the proliferation of fast food outlets, and the proliferation of this cluster of nuisance uses that are dominating the corridors and the nodes. I think with that, if we are successful, we can probably make a small dent into the quagmire that we find ourselves in. And thank you very much.
Thank you, Faisal. And one of the next key dimensions of planning and land use has to do with transportation issues. And so, Malcolm, we're going to have you talk a little bit about why is transportation a health issue and what is happening from the city perspective to really try to leverage both funding and policy to improve the health around transportation.
Thank you, Lark. Thank you for inviting me. Thank you, Lark. Thank you for inviting me. Health is a transportation issue, and transportation is a health issue. There's a book that's relatively popular right now called Born to Run by Christopher McDougall, and in it he talks about he talks about a number of things, including a tribe of people in Mexico who basically race each other around the desert that they live in the Copper Canyon. They go on 100-mile races, just like kids 12 years old, women 75 years old. The whole tribe, they do this on a regular basis all their lives. And of course, they're some of the healthiest people around. And in the book, he kind of talks about some of the people who have studied human evolution and anthropology, and they've come in to find out that we were born to run. That as human beings, that we evolved to travel long distances every day. I mean we can't outrun game on the planes and things of that sort. We actually just would we would just keep going after them until they got tired out. So it would be, so it wasn't like a fast thing that you think about in some big, glamour thing. No, we would just keep going until the herd of zebra, whatever the case may be, would tire out. And so we evolved to really, spend that. I saw another study that said that for ideal kind of human health is for us to take 10,000 steps per day. And how many people here think that they cover that? 10,000 steps a day, and that's but that's who we are. That's what we've So when I look at these health statistics that Dr. Baker gave us, and consider in the light of transportation in South LA, I think we're people that need to travel and walk and run and all of that, and yet we're cooped up basically. We've been corralled into a confined space, and it's just causing us all kinds of pain and suffering. And it's not an accident that we are corralled into that space, especially in South Los Angeles. The history of our community was the short story of it is that our community was considered a place to drive through instead of a place to drive to. And so we have streets that are made for maximum pleasure of cars, to maximum movement of traffic as fast as possible, and they're not there for the people that live there. They're not there for the kids that live there. They're not there for the businesses that are there. They're not there for the community to be able to get around on its own. And then, we've had freeways that have been, broken through the community, including the 10, including the Century Freeway, including the 110. And at the same time that they're building the freeways, they're also taking resources away from open space and from schools and from bus services or, other ways of people getting around other than the freeways. So it's not by accident that we do find ourselves kind of cooped up in a way that is very detrimental to our health. We have some of the people around this table and in this room and within the city. This problem has been identified, and the good news is that there are things that are going in the right direction in the way of transportation and one of my takeaways is going to be that the real question now is how do we capitalize on things that are investments that are being made. So I'm sure most of you have probably seen the Exposition Light Rail line that is being constructed within our South Los Angeles. It's going to tie together Culver City with USC, with downtown, and ultimately going out to Santa Monica. I was involved in litigation to try to help make it a little bit safer. We had issues with it being very close to high schools and elementary schools and that thing. And so thanks to some really great organizing on the part of the community, there were some positive changes that have been made, and that fight always continues. But it's going in, and there's going to be a number of stops that are within our community, and opportunities for people without cars to be able to get out of our community in a convenient way. The Crenshaw light rail line is the next one that's coming in. That was funded through Measure R. We passed that in 2008, and it's going to go from the Expo, where the Expo line hits Crenshaw, and then going out to the airport. And we're also having discussions about how that is going to be funded. Environmental reports are in on a station at Leimert Park, but the funding's not there for it yet. And so that's something that is out there for all of us to hopefully work on. But that's going to be another major light rail line going through the community of South Los Angeles. The 110 freeway, a lot of people might not know, but there is a congestion pricing plan that's being implemented there. So they're going to actually, it's kind of a pilot project to see how the freeway move more people by letting single cars pay to get into what used to be the carpool lane. But one of the things that came out of that is that through the funding of that, there's a $300 million in federal funds that are coming to support that, and part of that is being spent to enhance the corridors, parallel corridors. And so there's opportunities there to get involved and kind of make sure that happens. Faisal mentioned the community plans, that we're going to hopefully make those as pedestrian and bicycle friendly as possible, and kind of get away from this car-centric model that we've had in the city. USC master plan is on the table as well. So that's the biggest employer and biggest institution within this community by far. And then there's also we've had a number of rapid bus lines that have come in on most of the major corridors, and those have actually only been partially implemented from what they were originally planned. So there's still work to be done there in terms of making the rapid bus lines be as similar to the experience of a mass transit type rail line as possible, but using bus services to do that, which is a lot more economical in some areas. So one of the things that I wanted to just make sure that people put on their radar screen as we go forward is that these light rail lines create opportunities for development that could be community helping, community oriented, or they could be very kind of like just traditional displacement, big box, whatever the case may be. But once you put a rail station in, it creates a new market. And so that, and in other places, churches and business people and union people and contractors from the community and city officials can all come together to decide what they want to see out of these new opportunities, and what do they want to see it look like. And so, I mean, the goal is that people will be able to leave their house and access the transit infrastructure that we have in our city on foot. And so that gets you back to being able to make your 10,000 steps by being able to walk to and from the light rail station, and once you're on the train or wherever you're going, you're walking there, and it's a lot more healthy of a way to get around if it's possible. But one of those things is to make sure that it's not just a station in the middle of no place that's inaccessible. We want to make sure that it's accessible and have the pedestrian infrastructure there and the dense development around that station and commercial development around that station. And it's also an opportunity to jumpstart some of the commercial development along some of these corridors that Faisal was talking about, that can be woken back up by tapping into the new energy that can be created from that. And one of the other kind of concepts around that is complete streets that people are talking about, which is just essentially, that is the whole thing of taking our streets back from the automobile and restoring it to a multimodal use, or a multi-purpose use. And so our commercial corridor is not just for traffic to go through, but it's businesses that are there, it's people that use it as their kind of living room, it's transit, it's pedestrians, it's bicycles. So everybody kind of has an interest in seeing that street be accessible and useful to them, not just cars going through. And so that's the new kind of standard of what we're trying to accomplish with the planning model for streets, and DOT is slowly being pulled into it, and planning is being pulled into it, but so hopefully we'll get there. But the most important thing to get there is public participation, because ultimately the streets will be planned for the people who plan them, and that's why one of the focuses that we've had at Legal Aid all along has always been to try to put the tools in the hands of people in communities to effectively participate in all kinds of different planning processes of transportation, and because ultimately when you get in the room, and if it's just engineers, that's what it'll be. But if it needs to be people from the community, so I would encourage everybody to participate with MTA, with SCAG, with DOT, to show up and make, and let other people know that you can bring into it as well, and just make sure that everybody's voice is heard in the process. Thanks.
Thank you, Mike. So we're going to have to wrap up this session. I did have one question I want to throw out. It's just going. I see Valerie signaling me saying, I can do that. I have 10 minutes? Okay, great. You heard a lot today. Two issues came up that I think are important for us to address. One is this issue of equity and the fact that when we look systematically across healthcare, planning resources, city investment, we have a struggle around the issue of equity in our community. So I'd like to hear people's thoughts on how do we begin to address this issue of equity or inequity that's confronting South Los Angeles.
Well, if I jump on that, and I think that's the key, don't even look further, but just take the transportation issue and the infrastructural investment that MTA is making. It's probably the largest investment we have done so far for South LA. The question is not what you invest, the question is how you invest and how you plan. If you just lay down infrastructure through South LA so that it transports people from downtown to the west side, then that investment created more negative things in South LA. But if you plan this transit-oriented district, as Malcolm talked about, where it becomes the centers for uses that people care about, where you can place your clinic and your other things and your retail and all that, then it increases the quality of life, which in general enhances all the aspects that are related to health. I mean, when somebody lives in a better neighborhood, then a lot of other multipliers effect play. My fear, and I'm sorry that MTA is not around the table either on this one or on the transportation, but I think what we need to do is to bring sometimes the right players who are affecting our day-to-day life so that they are held responsible for what they are not doing and how badly they are doing things.
Yolanda?
I think it starts with two things. Looking at data, because sometimes this equity issue is tucked underneath a lot of data that you really have to tease out. And I'll give an example. In the county, we found out that a clinic in South LA that was leasing some county-owned property was paying 4 times more than a similarly sized clinic leasing county-owned property elsewhere. And so it's really asking hard questions, diving down, and being tenacious. And then the other trick is messaging, because the challenge with equity is the pie is only so big. So if you say you want more of your fair share, that means somebody else has got to give up some of their pie. And people don't usually want to give up their pie without a fight. So how you do this, whether it's through litigation, whether it's through charts and graphs that people are like, ooh, we got to deal with that, embarrassment, or whether it's some other messaging where ideally you inspire people to want to do the right thing.
Well, and I think some of this moves to the issue of public policy and to what extent do the dollars follow the need. I want to throw one more question out before we go, and I think what we see here today with this South LA focus is there is the South LA Strategic Initiative in which the City of Los Angeles is trying to harness its resources and address some of the issues. So the question I'd like to point to, since we've got such an interesting cross-section here, what and where are the opportunities for the county, the city, private foundations, public agents to maximize the impact of their investment in South Los Angeles? How can we do similarly what is trying to be done here with the South LA initiative? How do we leverage, and where are those opportunities for leveraging the work that is, the investment that is being made? Yes.
Well, there's some opportunities that we know about that come about with federal calls for grants, and there's these federal transformation, community transformation grants where the city and the county have in the past work together to submit joint applications on wellness and health. I mean, there's little things like that. But there's other opportunities. I mean, I just think about the school-based health center as a great example of that, where the city has an asset, and in that case, it's the land, and the county has an asset, which in that case are the resources and services, and then the community groups bring their expertise, and there's lots of opportunities. So if we pick strategically which of those areas where everybody has something to bring to the table, it's going to take a lot of work to braid it, but figuring out what are those particular types of initiatives that we can work on.
I think this really comes down to core values, because I think you're right going back to equity. But for me, this is about excellence, innovation, and leadership going forward. This is America, and America is built on business models. We're just using business models that don't work very well for this community. So I think now's the time to start looking at innovative ways, business models that make sense, because that's what's going to drive it. Fairness is always going to be a fight. It's always going to be an issue, but the business model prevails. So that I think it's up to us to look at innovative, because Albert Einstein, if we keep doing the same thing, even if we do it better, we're going to get the same result. So obviously we have to do something very different than we're doing today. And I think now with health reform, with us in recession, because recessions at times, deep recessions are when the greatest innovations occur. I think it's just an opportunity for us, the community, to demonstrate leadership and innovate.
Excellent. Anyone else want to add to that?
We have one issue to mention, which is the planning department is collaborating with a lot of other groups, including CHC, to see if we can leverage city expertise and regulations to impact the health. And we're putting together several applications to go after grants so that we can make some change.
Yeah, I was just going to say, I think, leveraging the business model that's available from transit-oriented development is something that's new within this community, because we now have a different market within our commercial corridors, and so there's a definite potential to kind of capitalize on that to bring about some things that haven't been there before.
Excellent. Well, I want to thank our panelists and those of you who have joined us today in this conversation. We hope it doesn't end here. We believe a lot of what has been discussed in the last 2 days probably could be framed in the context of the health of the community, and we hope we have an opportunity to continue this dialogue going forward. I want to thank our sponsors. Ms. Valerie, any last-minute cues? She's signaling you back there. And to wrap up, all right, we're done. All right. I'm like, what are you? Thank you.
For those of you who didn't get a chance to ask a question, you can do it now. That's